Welcome to all of those who have joined us today for our monthly Okanagan School of Business Speaker Series. I'm Dan Rogers. I'm the Executive Director for the Kelowna Chamber and honored today to be joined by Provincial Health Minister, the Honourable Adrian Dix. And thanks to all of you for joining in. It's great to have you with us today. We have a number of other folks that have also joined us, including the current president of the college, Jim Hamilton. I'll get to him in a moment. We'll also more formally introduce the minister as well. We also have Jeff Robinson, the president of the Kelowna Chamber. I'll turn things over to him in a moment to do the official introductions. But I do want to recognize and acknowledge that we're gathered today, at least those of us in Kelowna and the Okanagan, on the unceded territory of the Syilx Okanagan people. We thank them for their rich history and culture. A couple of housekeeping items off the top. We are recording today's session and it will be posted on the Chamber's YouTube channel a bit later today so others can review the discussion. I assume many of you are used to the features of Zoom, but just in case this is your first time, we'll be using the Q&A function to take questions, so feel free to use that at any time, and we'll get to those as time allows. Please be aware that we have a limited amount of time with the minister. He's been gracious with his time today. We might not be able to get to all questions, but we'll try to get to as many as we can. We also have some questions already in the pipeline as they relate to issues and policies that our members have identified. Once we get through the opening remarks, I will facilitate that question and answer portion. We're scheduled to conclude prior to or just around 1 o'clock, and we'll see how things go. And there will be some final comments prior to sign off. I also want to acknowledge that MLA Norm Letnick assisted us in coordinating the minister's appearance, and I think he's with us today. Chamber appreciates that all our legislative process works when everyone understands their roles and how our parliamentary system works and functions. And as opposition, part of the job for the official opposition is to hold the government accountable. But there are occasions when it's necessary to reach across the floor and unite in the face of significant challenges, and I suspect most British Columbians, including those of us with the Chamber and here in Kelowna, appreciate the level of cooperation of all parties in the legislature when it comes to responding to COVID-19. I do have some blatant promotions to make note of before we get into the official introduction of our guest speaker. We have a number of events coming up that I want to plug because I know at the end everybody leaves right away. Our Business Excellence Awards will be a little bit different. They'll be online this fall. Nominations are still open, but will close next Friday. So if you want to recognize a local business or organization for showing their resilience, just check us out online. It's easy to make a nomination. That closes next Friday. We are proceeding with our golf tournament, though it is a day of golf, respecting protocols related to COVID-19. We're pleased to have Park Pacific Projects back as our title sponsor. It's going to be a great day at the Harvest. They always treat us great out there. That's on September 17th. We have room potentially for one more foursome or a couple of twosomes. To join us, just check out our website. And our next Okanagan School of Business, this is actually a special one. We usually take August off, but we're pleased that the minister has made himself available. But in September, we're going to bring in the media and scrutinize a little bit of the media's role in the age of the pandemic. We're pleased to have a couple of veteran reporters joining us, including Chris Walker of CBC Daybreak South and Doris Bregalizzi from Global Okanagan, who will join us from their perspectives and share their thoughts, along with a couple of seasoned and respected former journalists, Cam McAlpine and Chris Olson, who both work now in the communications consulting world based out of the Okanagan. Also want to remind those that have joined us, if you don't already know, the chambers throughout the Okanagan have teamed up and formed a coalition to provide resources and information, and also to celebrate the resiliency of some organizations and businesses in the face of the pandemic. You can check all that out at OkanaganWeGotThis.com as all the chambers respond to the current challenges with respect to COVID-19. Do want to acknowledge our President's Circle members and all the members of the Kelowna Chamber, including Interior Savings, MMP, BDO, and UBC Okanagan. And I want to acknowledge our affinity programs as well. Now, with that out of the way, we're going to continue on with an introduction to Jim Hamilton, the president of the college. It's great to have Jim back. Just to give you some background, Jim's worked for School District 22 as an administrator and served a term as school trustee. He became president of the college in 2004, actually began his career at the college in 1980. Prior to becoming president, he was actively engaged in the college, having served as a member of the Okanagan University College Board of Governors, as a faculty member, and as regional dean for the North Okanagan. Additional posts include his position as board member of the Asia Pacific Gateway Skills Table, a member of the British Columbia Council for Admissions and Transfer, and director of the Irving K. Barber British Columbia Scholarship Society. Hold a master's degree in English literature, and I'm going to bring him back. And Jim, I apologize if that's a long bio, but it was important to note because you've been a great partner of ours and you are approaching the end of that tenure. So at this time, I want to thank all that have joined us and turn things over for Jim for a few words on behalf of the college.
Well, thanks very much, Dan. I think you'll find that my comments might be a little shorter than the introduction because I know we're all anxious to hear from the minister. So I just want to talk a little bit about some of the things that are happening around that are related to the topic of today's discussion. So although 2020 has brought unexpected challenges to our institution, which incidentally has been training frontline healthcare workers for 57 years now, it's also brought some deeply inspiring examples of the vital role our students, alumni, and employees play in our communities. Our more than 11,000 alumni perform many vital roles across the province, from nurses to therapist assistants, healthcare assistants, human service workers, and others. And we have students and recent graduates right now on the front lines, putting their skills to work where they are needed, perhaps more so than ever before. And we'll keep educating and graduating those individuals who will take care of our community, our families, our children, and our grandchildren. And on that note, I want to extend our thanks to the British Columbia government for its continuing investment in the future of healthcare professionals. This fall, we'll be opening a new, nearly $19 million health sciences center on our Kelowna campus. The support of the province and our surrounding communities is making that center a reality. Mr. Dix, we know that it will be put to very good use, providing a world-class learning environment for our students for the next 50 years. So I want to end by saying this. We're very fortunate, I think, to live in a province where leadership at all levels, and as Dan noted, from all parties, has been guiding us well through this pandemic. Mr. Minister, thank you for the important role that you play, and I look forward to hearing you speak.
Thanks very much, Jim, and thanks for all the work you've done for a long time, and I'm sure we'll bring you back before we get into your change and your transition in the spring. So I'm going to turn things over now to our president, Jeffrey Robinson, to provide more formal introductions of the minister.
Thanks, Dan. Before I introduce the minister today, as a voice of business in Kelowna, it's a great to have a relationship with those who represent us in government. And today we're fortunate to have Steve Thompson, the MLA for Kelowna Mission, also Norm Letnick, the MLA for Kelowna Lake Country. I also want to acknowledge the Kelowna Today, Ron Cannon, Derek Gratz, Pamela Pearson, and Ellen Volke. We also have with us Chamber President Nikki Check, who will join us to thank us today. I really want to extend a great welcome and sincere thanks to the Honourable Minister Dix for being with us today. We've all seen Minister Dix deeply engaged in leading the provincial government response to the COVID-19 pandemic, and we appreciate how, since being elected to Vancouver Kingsway in 2005, Mr. Dix has forged a reputation as a passionate advocate for his constituents and their concerns, and one of the most effective members of the BC legislature. He has consistently raised awareness of key issues and forced needed change in areas ranging from childcare, seniors, fair treatment of workers, and protecting public health research. Minister Dix served as the leader of the official opposition from 2011 through 2014. During that time, he played an instrumental role in advancing public policy changes in government. Several of those important changes were on the health front, including the BC-wide colorectal screening program, insulin pump coverage for young adults, and lower generic drug prices, all of which became provincial policy. Thank you, Minister, for taking the time out of your busy schedule to be with us today. We look forward to your remarks and also our further discussion about public health in our province.
Hey, thank you so much, and it would be really great to be there in person. In fact, I think about 7 years ago, I spoke to the Chamber. I think it was at the Capri in Kelowna, and at that time, there was, I think, more interest in me in general, because as Jeff just talked about, I was leader of the opposition at the time, and so there was lots of interest. And ordinarily on those occasions, you know, you'd come and you'd speak, and you'd meet everyone in the room, you work the tables, you give a speech, you take the questions, you learn, and there would be a little bit of engagement. And today, of course, we're doing it by Zoom, which is, I think we generally can say, both pretty good and something we're getting used to, but not as good as being in Kelowna in person. So thank you very much for inviting me in this forum. And the other thing that's changed, of course, would be the subject of my speech. If you had invited me a year ago, or in the times prior to January of this year, I would have been talking about the government's health record, of which I'm very proud, and the work we're doing together, the work and its impact in Kelowna. And I know there's some people there from Vernon and Penticton on the meeting today, and at the meeting today. The urgent and primary care centers in Kelowna and Vernon, and perhaps soon in new communities in the region, the primary care network in the South Okanagan, which I think is new and the best primary care network so far developed in the whole of British Columbia. I'd probably talk about the PET CT scan that just gone in Kelowna, which is an extraordinary thing. What it means, like the one in Victoria, is that more than 1,000 interior health residents will not have to come after or in the midst of a cancer diagnosis, will not have to come down to Vancouver for a PET CT scan anymore, which will make a huge difference in their lives, about changes in seniors care, and about changes in surgery and improvements in surgery, the increase in the number of MRIs and the use of our existing resources in healthcare, all of the healthcare issues that we deal with, primary care and seniors care. In fact, I'd probably talk to you a little bit today about what I announced just about an hour ago with Norm Letnick, the MLA for Kelowna Lake Country, the opposition, the official opposition health critic. We just announced the reform that we've been pursuing together at a joint committee with equal voice and unanimous recommendations with our colleague from the Green Party, Sonia Furstenau, to reform health professional colleges that regulate 121,000 health professionals, including a goodly number of your members of the Kelowna Chamber of Commerce. And we are moving, for example, from 20 health professional colleges to 6, and increasing public transparency. But of course, all of that, and much of it has been relevant to our public health response to COVID-19, of course, pales in comparison to the pandemic we have today. And so I want to talk a little bit about that, and not talk for too long so I can take some questions, but I'm going to just talk in sort of a little bit as the pandemic as it has been in BC, how it is now, and what you can expect in the fall in terms of health action. I want to note, and I know that Steve and Norma are on the phone, that the work that we have done together prior to COVID-19, Norm and I, in trying to put forward positive reforms in healthcare, has allowed us to develop the kind of, I think, relationships that work in politics, where people who differ on lots of things, Norm is no less a member of the Liberal Party, and I'm no less a member of the NDP than we are before, but have allowed us to work together in a very dynamic and formal way, an immediate way, in a regular way, in a daily way, to develop a public health response to COVID-19. Because when you're in times of emergency, as we have been just this past week in the Okanagan with wildfires, or in a time of pandemic, people have to come together. We can't afford for those to support the pandemic effort together be the 40% of people who support the Liberal Party, or the 40% of people who support the NDP, or the 16% of people in the last election who support the Green Party. We needed everybody. And that means giving voice and giving authority to everybody. And I think Norm Letnick has been one of my most important advisors. And I think the kind of change we've brought to the way we've engaged, not just in COVID-19, but in other things, I think is a model for how we should engage in politics in the province. I think I have enormous respect for Norm, and I want to acknowledge him today. But I think what it tells us, I think, about how we need to go forward on a variety of issues. That doesn't mean there can't be difference, and there shouldn't be difference in a democracy. That's what, in part, democracy is about, different views and the exchange of ideas, and sometimes, indeed, the fighting between ideas to decide what the best route is. And that's the subject often of election campaigns and others. But as I say, there are times in our lives, and 2020 is one of those times, when we've got to reach past those things. And I think that we've tried to do that in the best possible way. And I think the result for British Columbians, to hear people working together who you wouldn't expect to work together, has allowed us to achieve a collective consensus that's helped us deal with COVID-19. So, a few things about where we've been and what was unique about the British Columbia response and where we are now, because there's some challenges right now and where we're going. I think what's unique about the public health response to COVID-19 in BC is how early we started. We formed our essentially emergency response committee that was chaired by my Deputy Minister, Steve Brown, and by Dr. Bonnie Henry, who you all know very well from her presentations to the public, her extraordinary presentations to the public. Started in January. In the middle of January, we had started preparing for this. And I think what is impressive about, especially about both Mr. Brown and Dr. Henry's effort, is that from the middle of January, on a regular basis, all of the health authorities, the regional health authorities, the provincial health authorities, the First Nations health authorities, all the key players in our public healthcare system came together and met and made plans and designed an approach in the same room from the beginning. This has been a challenge in some other parts of the country where you have dozens in a city of different hospital boards, for example, and different jurisdictions. Here, we had a very unified response driven by the experts in public health from the beginning, from before it became a major issue to when it became the sole issue, in a sense, facing the province in March and in April. But secondly, I think our response early on was remarkable. Early on, we engaged in more testing than most jurisdictions, and this issue of testing is one we can revisit and maybe the subject of questions. But early on, we were able to break chains of transmission. In February, we discovered the outbreak of COVID-19 effectively in Iran. The first case, there had been no reports from Iran of COVID-19, but someone who had come from Iran to Canada was diagnosed with COVID-19, and then subsequent to that, we found the significant outbreak in Iran. But our willingness to test and the actions of our frontline workers in public health allowed us to slow in the initial stages the transmission of COVID-19 in British Columbia, and that was very important. We learned. We had our eyes open and we learned. We weren't always right. While we formed a committee in January, nobody anticipated what would happen within a couple of months. But when events happened in other jurisdictions, when people in Quebec returned from spring break sick, we took some very decisive actions, indeed extraordinary actions in March. Actions that received, I think, broad public, not just broad public support and approbation, but also broad public action. And that was vitally important. And so the result of that, all that, and finally, we established a significant number of public health orders, but fewer than just about every jurisdiction in Canada. Some industries that were closed in other jurisdictions in Canada and the United States, industries like construction, were never shut down. Instead, we implemented a public health approach in consultation with those industries, and people kept working because we know, and all of you who work in that sector know, for example, the high level of challenges with addiction, for example, in construction. The importance of keeping people working was central to our thinking. So this was a public health approach. It was supported by people in the province. We threw a lot of energy into it and made some extraordinary decisions. For example, canceling elective surgeries or not having visits in long-term care. We engaged in some public policy decisions decisively that were made by provincial health officers and then supported by the full resources of government, ensuring, for example, that people in long-term care only worked at one site, ensuring that temporary foreign workers in agriculture, where other jurisdictions in Canada saw significant outbreaks on farms. In British Columbia, we ensured instead a 2-week quarantine. And in fact, more than 30 healthcare workers who were temporary foreign workers coming to Canada ultimately tested positive in such quarantines in BC. These actions stopped the spread in those areas of COVID-19. The result of this, of course, as you know, in May and then in June, was a significant flattening of the curve, but also importantly, a lower rate of mortality in BC than any other jurisdiction in North America, which continues to this day, even as cases have climbed back up in July and August. Our ability to provide excellent critical care and our ability to ensure to the greatest extent possible that vulnerable people were protected was important. I just want to stop though by saying all this because I think that we also have to feel humbled as a society and as a government, and I do as Minister of Health, with all of the effort that people in BC showed and all of the extraordinary work by Dr. Bonnie Henry, who may be one of the world and is one of the world's leading experts in pandemic, who has worked in dealing with pandemics from Uganda to Afghanistan, to Toronto, to here. Even with all of that, the cost has been extraordinary. 203 people have passed away, and I think we'd all agree that's 203 too many. Many people have got sick. We know the consequences to the economy of the province of what has happened. We know that people who have owned businesses all their lives see those businesses at risk. We know the consequences for people in long-term care of not having visits. We know what it is for all students to not be able to attend in class, as many students haven't done since essentially St. Patrick's Day in our province. The cost has been enormous, and it humbles us, and it reminds us that COVID-19 has no cure and no vaccine. That COVID-19 doesn't care what kind of people we are or what kind of speeches we give. And we have to be humble, and we have to continue to take action. So that's the past. The present is what we know. And I just want to say, though, in the context of the present, the increase of cases, especially amongst younger people. I hesitate to call people, for example, who are 37 or 38 young, even though they're younger than me. They're probably too old to play in the NBA or the NHL. And in any case, people between 20 and 40 are adults. So I don't want to be condescending in any way, as some of the discussion sometimes is about young people and what they're doing. Young people have suffered more from COVID-19 in terms of job loss, in terms of other consequences than anyone else in society. That's what all of our other analysis, non-COVID analysis, tells us. But we have seen in recent times an increase in cases. And I think our response to that, the response we're making now is we've opened up the economy starting in the beginning of May when the Premier announced that we were moving to phase 2 in our COVID response plan. The opening up of the economy, the increases in activity has seen some increase in transmission, especially recently. And here, I think there is some hope as well. And as I describe it everywhere else in the province, that hope is called Kelowna, and how we responded in Kelowna to COVID-19 and the spread of COVID-19 in Kelowna and to other health authorities from Kelowna in the first weeks of July of this year. What we did in response, we all know that some of the reasons why that happened. But I think it's important to also highlight the response. Extraordinary work by Interior Health in terms of contact tracing and stopping the spread once people were diagnosed with COVID-19. The work they did to find people and to assist people and help them get well was beyond extraordinary. Remember, we went from 2 active cases near the end of June to 85 active cases in a small area in a short period of time. And that was a dramatic shift at that time. But it wasn't just them. The Kelowna Hospital Foundation got involved in spreading a public health message. We made some changes in public health orders, especially around short-term rentals and things such as houseboats, to clarify rules and to make people safer. The business community got involved in a fundamental way. And I'll just say this, we were going in one direction, there was a significant increase in cases, and today, everywhere in Interior Health, in the whole Interior Health Authority, there are 20 active cases of COVID-19 in the entire Interior Health Authority. It went up in July and it's been flattened again in Interior Health. And that's because of public health, that's because of the community, that's because of people like Norm Lednick, that's because of people like the Mayor, Colin Bazran, that's because of the businesses who are represented here, the Hospital Foundation and everyone. We can do this when we have unity of purpose, and we require unity of purpose, and we continue to require that as we go forward. So as we go through this period, and mostly now, we have a pandemic that's kind of 2 pandemics right now. One, a significant increase in the number of cases, particularly right now in Metro Vancouver. It was Kelowna in July, it's back in simply in Metro Vancouver really today. Very little spread of COVID-19 elsewhere. So 2 pandemics in terms of where right now, although we know that can change, and it did in July in Kelowna. And secondly, that we have continued to do a reasonably good job in dealing with the challenges of the vulnerable. Just to put this in context, in August, 9 people in BC have passed away from COVID-19, and we mourn them. But you compare that, for example, to Alberta, where I think the number is well over 40. Compare it to Quebec, where the number is over 80, and of course to Washington State, our neighbor to the south, where it's well over 100. You'll see that at the high level of vulnerability, where people would pass away from COVID-19, BC continues to do a good job, and that people who are in vulnerable categories, people like me who have type 1 diabetes, but also our elders, are doing a good job, and we have to continue to protect them. So that's where we are now. So what do we have to do going forward, going into the fall? Because I think there's a lot of anxiety about the fall. Some of it's related to schools, and we may get into that in the question and answer. But some of that's related into what a lot of people talk about, and there are, as I've come to learn on social media, millions of epidemiologists today, all over the world, who are expressing opinions about these questions. But there is a lot of concern about what we call a second wave. Now, whether there will be a second wave or not, or what we can expect in terms of transmission in the fall, is really a matter of conjecture. And nobody knows, because this is the first time, the first year we have COVID-19. We have no experience from last fall to guide us here. But here's what we know. We know that starting in October, we go into cold and flu season. We know that there's higher respiratory illness in the fall. We don't know what that effect is on COVID-19, but we know that a lot more people in cold and flu season are going to be experiencing COVID-19 type symptoms. We know that. And we know that that's going to present real challenges for the healthcare system. And we know that with time in advance, with having learned the lessons, good and bad, about what we did in the spring, we need to take actions to avoid the kind of shutdowns to the economy that could come if we saw a major spike in COVID-19 cases. So what are some of the things we have to do to prepare for the fall? And what are we doing to deal with that in health? There's a whole economic question, which perhaps we can deal with in the Q&A, but I'm going to focus on the healthcare question here. The first is we need to increase our capacity to contact trace And so we're hiring 500 more contact tracers, essentially doubling the number of people doing contact tracing in our province, so we can respond should there be outbreaks quickly, such as the one in Kelowna, and get them under control, help people when they're sick, and stop the spread of COVID-19. And that is critical work. And while it's important to have what I call state action or sometimes enforcement with respect to COVID-19 regulations, we have to remember that the key to stopping transmission is voluntary cooperation, and we need people to trust us in public health. So more contact tracing. We need to deal with the flu, and that means more immunization, of course, and the very measures that we're putting in place to deal with COVID-19, we believe, and this is supported from some evidence in the Southern Hemisphere where they're going through winter now, that the measures we take against COVID-19 may help eliminate or reduce the amount of flu in our province. We've got to increase our capacity to test. And we have right now a daily testing capacity of about 8,000, and we need to raise that to 20,000. Not because we think we're going to need to do 20,000 tests a day, but we're going to need to have that capacity should there be a significant increase. We've got to learn our lessons in the hospital sector from the spring so that we won't have to cancel all elective surgeries as I had to do around March 18th of this year, but to maintain and keep as much of our healthcare system going in the face of a spike in COVID-19 and to keep those working in healthcare as safe as possible. So we have a new plan for the acute care sector in the fall. And we have to make the hiring and continue to make the changes to keep our long-term care facilities safe in our province, because we know that people in long-term care are vulnerable. So you're seeing the changes in visitation, but you're also going to see the addition of significant staffing across the long-term care sector to ensure that we can have more visitation, which is necessary for life for people who live in long-term care, while we keep people safe in long-term care who are, as we know and as we've seen, particularly around the world and in parts of Canada, unbelievably vulnerable to COVID-19. In short, we have to take the steps now and are. The last month or so has been my busiest month as Minister of Health as we prepare for this fall. It wasn't March and April and May, it's now. Because now is when we take the learnings from March and April and May and we apply them forward. And I think that's what I'd like to leave you with, though, is the fact that we're going to have to be dealing with COVID-19 through 2021. We're going to probably have to be dealing with COVID-19, and we certainly are, through 2022. So that means that the new normal we create, the society we create together during this time, was going to require a consensus, a sense of common spirit, the kind of common spirit we've seen between people who disagree on all kinds of things. Blazers or rockets, liberal or NDP or green, Coke or Pepsi, all the kind of things that divide people in society, issues of age and taste and ideas, we're going to have to put some of those aside to keep working together. This is an unprecedented pandemic in our lifetime. It has changed how we function and who we are, and we have to keep going. We have to maintain a degree of common spirit and common interest if we're going to succeed, if we're going to keep our society as open as possible while respecting COVID-19 and its dangers, and by putting the resources in place to deal with people, to do what we do well in Canadian society, help those who are afflicted with illness get better, and help protect people from getting sick, while supporting everybody to build a better British Columbia and a better world. So that's what we're trying to do, and that's kind of the direction we're going in. And I'll hand it over to you now, Dan, for some Q&A.
Well, thanks, Minister, for those opening comments. We had talked about, Jeff had some questions that we were going to go to, but I think we'll jump to Jeff right away. We've got a number of questions that have been forwarded us from those that have joined us and from our members. So I'll try to get to those, and we're doing this on the fly, Minister, so I'll try to paraphrase some of this just to make it easier when we get there on the questions. The first one, and I should preface, while we represent our members in the business community and the business community at large, even those that aren't a member of the Chamber, because we're focused on the economy, and the economy helps lead to prosperity for all. We do have, as most chambers do, many nonprofit organizations and organizations that are doing a tremendous amount of good work in our communities. And one of those is local hospice, as an example. So when you look at the current situation, and I'll try to frame some of the background here for the question and the role that volunteers play in palliative care, and then you look at the frontline workers, the nurses, et cetera, and the stress that they're putting on. Could you give some sense from your position as Minister of Health, the recognition of those volunteers, the palliative care and hospice, and is there a greater role for them to play, considering the response with respect to COVID-19 and those the tragic fatalities that we're seeing? Those volunteers are already there in the system. Recognition of that valuable role they play, and a potential greater role that they could play going forward.
I think it's absolutely true. I mean, just to speak of hospice, which is really started in many respects as a grassroots movement and is now extended, and of course is a big part of our healthcare system, but it has its roots in sometimes in people of faith, but always in people of who put the interests of others first. I think the work of volunteers in hospice is extraordinary. And this has been a really challenging time. You know, this has been a period, and we continue to only have what are called defined essential visits in acute care, and defined essential visits in long-term care, plus one designated family visitor. And so the role of staff in filling that void is an enormous burden. This is a time of extraordinary anxiety and pressure, and often people who live in long-term care. And if you're in long-term care, you're there for a reason. No one has the desire to be in long-term care in and of itself. Generally, there's significant physical or, and sometimes challenges. Other challenges, a very significant number of people who are currently in long-term care live with Alzheimer's or other dementias. And so the role of family members, and then the role of volunteers to supplement and to not just extend life, but to provide those things that make life worth living is essential. And that's particularly true in hospice care. And so absolutely, I see a growing role from that in a growing hospice movement, and a growing challenge in the next year or two. How do we ensure the safety of our most vulnerable, while not taking away, let's say, the joy that makes life worth living, or the supports that's needed in a period that we don't like to talk about very much as we prepare to die, and we don't like to talk about that. So I think the role of volunteers is critical in that, in ensuring that volunteers are themselves protected in those settings and aren't bringing obviously COVID-19 or other problems or other health problems into facilities where they're volunteering. So this requires, and what we've done, I think, from the beginning in long-term care and in other health facilities, which is whether a long-term care facility is public with privately owned with public beds or not, to incorporate them into our PPE supply chain has been critical, both for volunteers and for staff. This is true in acute care as well. And so ensuring, in fact, that volunteers are able in these difficult times to provide the services they need. And I do see a growing role for that. And a lot of what we're doing, the increase in resources in long-term care, for example, and in assisted living, increased resources in acute care, is to try and achieve that. One of the things that pains me the most about what's happened with COVID-19 is the restriction on visitors in long-term care. Because I believe ultimately that in either long-term care and hospice and assisted living, that the quality of life is important. So much of what we spend money on is the extension of life and the protection of people. But we have to live, and we have to live with all the liberty we can express. And volunteers and care staff make that possible for people.
Do you anticipate, Minister, given there's still a lot of knowledge being acquired during the pandemic, that those protocols, changing at all in that circumstance, or?
On visits, yes, but you'll note how methodical we've been, and this is very difficult. And and I know the experience of families because it's my family too that's in this circumstances, that I believe we do have to expand our visitation policies, but we have to be methodical. We decided on June 30th to expand visitation beyond the current essential visitor policy. We made some adjustments for people with disabilities in May, but beyond our existing policy to one essential visitor per resident. And the reason we did that is we didn't want to overwhelm facilities. And if you put it in context, just in long-term care, 31,000 residents means 31,000 more people accessing long-term care where there's COVID in communities. So we have to act prudently and methodically. And we are hoping to continue to expand that out by investing at this $160 million in long-term care and resources on the acute care side that essentially have for a goal to expand visits and expand the quality of life of people in long-term care. So yes, I do see it expanding out, but it's not going to be a quick process. We're going to take it step by step and ensure that people are kept as safe as possible.
Great. Minister, we have a number of folks that are using the Q&A function, so please feel free. The Minister has been very gracious with his time. We've got 15, and maybe we can push it to 20. So we'll try to get to as many questions as we can. One of those, and I'll paraphrase because they are coming in live. Paul makes a question with respect to balancing the response of COVID with other health concerns. Off the top, and we certainly have flagged this, the opioid crisis and the rise of deaths there, and that may be an illustration of what Paul was asking here. Is the response to COVID jeopardizing our ability, and generally speaking, to respond to some of the other health crises or issues and ensure that there's care there? And I think probably a good example, and we've had recent announcements with respect to opioid deaths in the province. Is there any plan to change direction? Is that being monitored? Some information and background, if you could, there.
Yeah, I think it's careful. I think people need to be careful in being, in having sort of simplistic analysis, which sometimes appear in the debate. Dealing effectively with COVID-19 allows us to deal with other things. The fact that we flattened the curve has allowed us to do 1,000 more surgeries in the midst of COVID-19 in the last month than we did in the same period the previous year, right? Which is an extraordinary achievement, not by me, but by doctors and nurses and healthcare workers. And it wouldn't have happened if we had, as we did on April 5th, 149 COVID-19 patients in hospital. It couldn't have happened. Certainly didn't happen in Italy when their acute care system was overwhelmed, right? So it's not, these issues are not an or, COVID-19 or overdose crisis, COVID-19 or surgeries, or diagnosis, or cancer. It's inevitably and an effective response to COVID-19 in a pandemic allows all those things to happen. But that said, the issue that you raised specifically, Dan, the overdose crisis, has clearly been exacerbated by COVID-19. In the first budget I was part of as a government member was September 2017. And there's in that budget that time, there was no additional budget. It was the first NDP addition, essentially building on what had been a Liberal budget in February 2017. No additional money for anything in healthcare except mental health and addictions. All of the incremental money went to that. It was $300 million in that budget, and it has grown. And in the period leading into the COVID-19 crisis, the number of overdose deaths had been reduced basically by 37%, which is significant. But it was still way too high. I mean, way too high. Like this, it's not anything in any way to trumpet, but all of the additional actions, the treatment beds, and the efforts to ensure more access to safe prescription supply, and all of the harm reduction efforts by the government, all the housing efforts, all those that had a consequence. Then COVID-19 came around, and it isolated us from one another. And it created, because of the circumstances that we all know, a more toxic drug supply. And now we've had 3 months. It was 174 people who died of overdoses in July, 175 who died in June, 171 who died in May, 117 who died in April. And these are increases, and these are record numbers. 175 is an absolute record. And so the impact of COVID-19 on those dealing with addiction in our province and a toxic drug supply is what we've seen. But the answer to that is not abandoning our efforts of COVID-19, but it's adding to our efforts to address the overdose crisis, and to saying to people, especially people who use, you're not alone, and do not use alone. And all of the efforts, we've made significant efforts in terms of access to hydromorphone, for example, which has tripled in this period, to give access to what I describe as a safer supply, and the increase in treatment beds. All of these need to be done, but it is not a simple problem. It's not something it's not a curve that can be flattened in a week or a month or anything else. It's a much more challenging and long-term chronic disease problem that we are going to have to invest in. And so, we have to also appreciate the toll that it has on the community. And it's not a simple matter. The toll it has on the community in every possible way, and on businesses and on local community people, and on the relationships between people, and one's sense of what your community is. And this is true in Kelowna as it is in my neighborhood in Vancouver. And so this is going to require comprehensive, multi-pillar action that's going to take time. But we've been taking urgent action now, and we need to take more. But ignoring COVID won't make that better. We've got to do both.
Minister, and Jeff has rejoined us. We do have some policies that our members identified that we brought forward to the BC Chamber and were adopted, and we have a couple more questions. So I appreciate you staying just past the top of the hour with us to get to those.
I'm good. I'm good till 1:15, but I think you're trying to kick me off again.
No, we're all good. Now we have 7 more questions being added, just because we'll get. But we'll get
That's
there.
What I'm here for.
So one of the, and Jeff, I'll come to you in a minute, but one of those policies that we put forward at the BC Chamber was passed and is now a BC Chamber policy. It was worked on by several chambers representing most of the major urban centers, and it dovetails on the issue that we're just talking about with the opioid crisis. There were, I think, at least 6 recommendations put forward and adopted. A lot of it kind of focused around greater emphasis on treatment, mental health, and addiction services. And in the Okanagan or Kelowna context, we as a business organization, but I think the population as a whole would like to see a greater emphasis on that treatment. And we are where we're located. We're a block away from an overdose prevention site. But we still face people on a regular basis injecting outside our front door or others. So it's a pretty significant issue. The policy we put forward and was approved was greater emphasis, among other things, including the 4-pillar approach that was talked about some time ago in Vancouver. And we're seeing, at least in communities, the challenge is getting worse, not better. Some of that is driven by the illicit drug that's available. But a couple comments, if you could, with respect to a shift in focus, in particular, giving interior health as an example, more resources. Is that something you have a regular discussion with the finance minister and cabinet? And as you see a key component, I know there's been some announcements, but if you could just respond to that.
Yeah, I think that the overdose situation sort of defies simple responses. It really challenges who we are, right? Because look, we have this experience. We have this experience in our own lives of people who struggle with addictions. And sometimes at an individual level, it's very challenging. There may be people in our families or our friends who suddenly are not the people that we knew. And they're driven by their addiction. It's not them, it's the addiction. They are medically ill. And we need a medical response that's comprehensive. Of course, some of that is prevention and attacking those that are, after all, distributing poison on our streets. What kind of society would we be if we didn't take action against people distributing poison? Some of it, I think, is an enhanced need for treatment and treatment beds. And that is not often an easy process, because there's the process that we define as treatment. And then there's a process that might follow that treatment and the supports that are required to make that work. Some people are, the harm reduction is a critical part of that, of course, and that means ensuring in a time when we have drugs that are killing people. Like the first time they use them, sometimes the first time someone uses an illicit drug, it kills them in our province now, because they're taking effectively poison. And we have to try and find safer supply. And we have to work with communities and have a community response. Because ultimately, I think, the challenge sometimes is that when you don't build that support in communities, that all of the good things you do, all the public health things you do, get lost in a discussion around the very things you talk about. Easy for me to say, it's not someone perhaps taking drugs in front of my business on my street every day. And then we have to deal with some of the problem, which is surely access to housing and supportive housing and supports for people for what is going to be a lifetime of damage. And in a modern sense, our ability to respond to people. People sometimes overdose again and again. And for those of you, I think there's probably some people in the audience who work in long-term care or who operate long-term care homes with public beds. They know that we have people in long-term care who effectively have been permanently harmed by their addiction. And the growing number of people who need our support and that long-term care support for the rest of their lives grows. So what it requires, to sometimes talk about 4 pillars, is a response on all of those fronts. And I think we can't have a debate where it's a debate between prevention and harm reduction, or a debate between treatment and safe supply. It's got to be all of those things. And that's what our strategy and our policy is doing, starting with children and youth as well, all of those things. And the final thing is to acknowledge that the soul, the core of addiction is pain. And we have to find better ways to deal with that. You know, we have to find better ways to deal with that as a society. It has to start with our compassion, but we have to be pragmatic too. We have to have all of the policies, not some of the policies, but all of the policies. I think that's what the plan put forward by my colleague, Minister of Mental Health and Addictions, Judy Darcy, does. But it requires all of it, not some, not a little bit, not one pillar, but all the pillars. And everybody involved has to come to terms with that. And it involves sometimes learning new things and changing new things. I don't think when I was growing up in Vancouver in the 70s and 80s, my gosh, we could have imagined that marijuana would be legalized, and marijuana is legalized and now. And that's a changing and evolving societal view. Some of our views are going to have to evolve because we're compassionate people and we're pragmatic people. And we have to use our compassion and our intelligence to help people deal with something that's a public health emergency, but on an individual basis is a health problem that they may need not just months of help, but years and indeed decades of help.
Thanks for that response. Respecting some folks that have used the Q&A, and we've got a few in there, but if you want to get one in, we'll try to get through these. We haven't approached what I sometimes refer to as the bullet round, which is I'll read them as fast as I can and look for responses, but and I'm going to come back to Jeff in just a moment. But Tracy's asked, I've seen that seniors care homes are seeing a slight increase in numbers with all the lockdowns and what we've learned. Why would there be, or is that something that is to be expected?
In terms of, in sort of increase in what numbers?
In seniors care homes, or?
In the number of them, the number of beds?
Yeah, number of cases, I suppose, yes.
Oh, the number of cases of COVID-19, yes. Well, I think everywhere in the world, seniors care, people in seniors care are incredibly vulnerable to COVID-19, and we've seen that in BC as well. And so we've taken a number of steps to deal with that. And we've been more successful than other jurisdictions, although we've had significant outbreaks. And we've seen at some of our best care homes in BC, nonprofit care homes with long histories in the province, very significant outbreaks, in which as many as 24 people have died. Right? And so we've taken very significant action in all those areas, I think. As a government from 2017, we've increased care standards. So when I became Minister of Health, there were roughly 85 to 90% of care homes that didn't meet standards. And now the standard that the government itself had set, and now at the end of this year, we'll have met that standard on average in every health authority. So we're increasing staffing, which is important. We've provided access to PPE. We've been engaged in a policy called the single site policy that says that employees of care homes need to work at one site and not work at multiple sites. This suppresses the potential for transmission. All of these steps and more, the visitation policy, all of these steps have been designed to reduce the transmission of COVID-19 in BC. And at the present, we have 12 active outbreaks in healthcare settings, 3 of them involving residents, all in Metro Vancouver. But I would say this, in the Interior Health Authority, this is a worldwide pandemic. We've seen how it affects care homes everywhere else. In the Interior Health Authority, not a single resident has tested positive for COVID-19, which is a singular achievement of our healthcare system.
Excellent. Thank you. Robert, and this is a specific question. He's asked with respect to staycations. And we're seeing, even with our members, as an example, we're a global destination, but that's not happening. But Canadians also travel globally. That's also not happening to the same degree. So as an example, with Big White ski resort, the domestic opportunities for tourism is significantly increased because many of us that are still working, and thank goodness some of us continue to have employment and enjoy that, have vacation still, and are looking for places. So as an example, I'll be going to the island next week to visit family. But there's a discussion and the question with respect to opportunities for enhancing tourism around camping and BC parks. And there is an area, probably a couple examples in the Okanagan where there's property available, particularly one large property near Ellison Provincial Park that could be converted. And we all saw the BC Camping, the crash of the site because desire to get back to nature, which is a positive thing for a variety of levels. Is this something that comes up in budget discussions, or sorry, with cabinet discussions? Certainly it wouldn't fall directly with your ministry, but in the overall response to the pandemic and opportunities to keep a healthy economy as well, acquisition of property, and Robert in this circumstance is suggesting the one, I'm not sure if you're familiar with it or not, but that open level of looking at other options to keep the economy, and in this example, expanding potentially those camping sites, I think is the question there. Not sure if you're privy to that or have
here's in general. I don't know the site, but I'm going to take back and talk to my colleague, Mr. Heyman, for the question. I'll ask him to maybe respond on that in general, but absolutely. I mean, we've gone, as people will know, from the lowest unemployment some of the lowest unemployment in North America, under 5% for a very significant period prior to COVID-19, to obviously double-digit unemployment. And many businesses that have hung on are struggling still. Right? So this has been the principal focus of the cabinet, I would say, of the government outside of the Ministry of Health, where we're dealing and focusing on the health aspects of the pandemic, which are very important and very important for the economy. So I think there's a series of actions we have to do to make our present economy more effective. I think in parts of the province which don't have the kind of internet access they need, it's very difficult to talk to people that are working at home and engaging in entrepreneurship when you don't have that access. So we need to say in this period, we need to expand that access. Access in many communities, and we've done this in a rural remote health context, to emergency health services and improving that and keeping getting so that everybody in the province, whether they're in Indigenous communities or not, are closer to the healthcare system. This builds confidence and allows us to continue to engage in rural development. There are airports in BC that need to be upgraded. You can create jobs, but also create economic opportunity that way, and significant opportunity in tourism. We've seen this in practical ways. People are eating outside more than they've ever eaten outside before because changes were made. The changes that my colleague David Eby made in terms of the price of liquor in restaurants and so on. All of those changes, I think, address the economy, and yet we need to do more, and you're going to see very significant action come September from the whole government on that. Because unemployment is bad for health, business failure is bad for health, not having children go to school is bad for health, that are the impact of the economic impact of COVID-19 is profound in our society. And so we have to respond by continuing to respond on the health front, because the better we respond on the health front, the more opportunities there are, on the one hand, but on the other hand, we have to respond to this unprecedented economic situation, which is facing every jurisdiction in the world. And one of the main areas we have to do that is tourism. And I think it's important from a health perspective. The Kelowna example I talked about earlier is important in that regard, because I think that in the long run, British Columbia's performance in responding to these issues of COVID-19 in the long run is going to help us in terms of tourism. But in the short run, we've got some very real challenges. And anything we can do to promote those industries, especially service industries that are struggling a lot right now, is really of value right now, because we have an opportunity, but it's beyond the horizon of the pandemic. And so during this period, we have to see, I think, considerable action, and you will.
Great. Thanks, Minister, and respecting your time, and hopefully you're not getting cues to go. We will look to conclude and wrap up in about 7 minutes from now, but we do have a few questions in the queue that I'd like to get to, but I wanted to go to Jeff, just to potential Jeff, if you want to raise the other policy issue. The chamber. It's a bit of a shift from the COVID, but life goes on with other aspects, as we've seen even with some of the questions that have arisen today. Jeff?
It's not often we get the health minister one-on-one like this, so I'm going to bring forward a policy we've had. It actually came from one of our members who operates a walk-in clinic.
Yeah.
And as you know, physicians are capped in how many patients they can see each day. And one thing that is used in the United States and also in the Canadian Armed Forces are what are called physician extenders or physician assistants. These are highly trained professionals who work under the supervision of a physician. And the thought from our member was, why don't we empower doctors to bill for people who can provide services the doctor would inevitably provide, blood pressure, monitoring, taking down symptoms, in order to expand the ability for primary care physicians in private practice to better serve their practices. And this idea would simply be having someone delegate out a function of a physician, but always under the physician's control. And we've seen it work in other jurisdictions. And so we're wondering, we've seen moves towards nurse practitioners, but this is kind of a private sector analog to that. And I'm wondering if your ministry's given any thought to that.
Well, it may be a private sector approach, but in effect, a lot of health professionals are that way. talking about access to the medical services plan and how we bill and what we bill for. Physician's assistants have been brought forward as an idea in BC a number of times before. As you say, they've been used in the armed forces and some other jurisdictions. We don't train physician assistants in BC, and they're not regulated in BC, and it's come forward a couple of times within the Ministry of Health under the previous government, but you know, it just came forward in the Ministry of Health. And they didn't proceed with the idea at that time. I don't reject it out of hand, but I would say this, that nurse practitioners, for example, and we've increased, I think, the number of spaces dramatically, can do a lot of what doctors do, but they work independently of doctors. So they expand, in fact, the ability to access the system. But team-based care, the coming together of doctors and nurse practitioners and nurses and pharmacists and mental health and addiction services, this is the basis of everything we're doing. We have a primary care network in the South Okanagan, Penticton and Summerland, that's in place now, and you're seeing these teams come together to do exactly what you're talking about, which is to take our medical professionals and allow them to work to the extent of their capacity and their skills to provide more services and to work as teams. I think the 20th century, in part because of the way we build for healthcare, fee-for-service system and others, was kind of a period for individual action and healthcare response in the community. But the 21st century is the time for teams. And so everything we do, the primary care network that's coming soon in the Central Okanagan, our urgent and primary care center, the community health center that's going to be coming to Lake Country soon that Norm Letnick has championed. All of those things are going to be involving teams, exactly what you're talking about, which is health professionals, existing health professionals who perform all the functions of physician's assistants, working together as a team. That's what we're doing in healthcare. That is, our entire healthcare plan is founded on exactly what you talked about. Physician assistant is something I don't reject out of hand and we're looking at, but it has some challenges here. One, we don't train anybody here, and there's no, and there has been no system, no regulatory system in place. And so what we're trying to build on right now is what we have here, increase their numbers. Nurse practitioners were sort of set up by when George Abbott, you remember from Shuswap, was Minister of Health. But when 2017, when I became Minister of Health, we were using them less than virtually any other province in Canada. Well, we're changing that. We're building out, and team-based care is a big part of that. So on physician's assistants, we're certainly not there yet. I don't reject it out of hand. But on team-based care, that's all we're doing.
Excellent. And respecting our time, we have a couple of comments in the chat. What I'll do is we'll just get forward those comments just up through your staff, so as appropriate you can respond to. But there are a couple of questions I will try to, Minister, combine them, just sensitive to time, and both relate to long-term care homes. And I know earlier in the discussion, you made some general comments. There were some follow-up questions with respect to the role that hospice might play in supplementing the needs. There's a comment with respect to, the medical, but the psychological needs and addressing those in long-term care homes. And can volunteers, or will there be any changes around there? And then there was a question similarly on visitation rights in long-term care and setting minimum standards. Can you give us some background? Does that fall within your purview with the ministry, or how is that? And you're probably hearing that quite a bit, right?
Yeah, it's a huge change, right? Like as an MLA and as a family member, I visited long-term care homes all the time, right, to support people. It's hugely valuable. Visits are hugely valuable to the well-being of people in long-term care. And in March 20th, when we suspended visits in long-term care, except essential visits under palliative circumstances, and we suspended visits in acute care, that had a huge toll, and has had a huge toll. And I hear from the people, and every day, or at the end of my day, I talk to people about these issues who email me and talk to me about it. And this is an issue that is hugely meaningful for families and the quality of life in long-term care. So that's why we changed the policy and added an essential visitor policy, one per resident, on June 30th. And in addition to that, we provided $26 million retroactive to support and improve infection prevention and other costs in long-term care. and $160 million annually going forward to add staff to support the visitation process. Because essentially before COVID-19, visitors in long-term care might have had, were incredibly valuable. They didn't take up staff time. There was often or generally some free access to visitors in long-term care, generally. If your family member was there, you could go, right? And it didn't require staff to organize. And now it requires staff to organize. So we are making a massive investment so that as we go through this pandemic, we can expand visitation to long-term care. On volunteers, I think I spoke to that earlier, but the visitation question is one I get every time I do a presentation like this, and it's one we're hugely focused on. And like I say, we're going to act methodically, hopefully to expand out, but we're only going to do that as we have the resources in place to keep people safe.
Minister, you've been very gracious with your time. I'm going to bring Nikki Check in here in just a moment to provide some thank yous. I wanted to squeeze one more in that we had. Well, we had lots more, but we'll follow up later, and hopefully we'll have another chance down the road, and potentially maybe even bring you back live.
Love to come back.
Great. It's a beautiful day here in the Okanagan. Is there a number that you're specifically watching? Is it the rate of transmission? Is it the rate of positive tests based on testing? We hear quite a bit, and we're flooded with, unfortunately, to some degree with the American media and the global media. What's the number as health minister you're watching very closely, and are you looking at each of the health regions individually in that regard to see how it goes, so that you know we're going to be in this for a while? So what's top of mind for you that you're watching closely?
There's a number of things I do, but as you're watching, here's what I see every day when the numbers come. First thing I look at is outbreaks in long-term care, because if there's a significant outbreak in long-term care, it means people will pass away, right? And so right now we have 12 healthcare outbreaks, but 8 of them involve a single person, usually a staff person. And so as long as that doesn't get worse, then that is not a significant outbreak. But you worry if there's any resident cases in long-term care. So when we announce that every day, that's the first thing I think about. Second thing I think about is the number of people in hospital, which talks about the severity of the illness. On April 5th, we had 149 people in hospital, which is much lower than we had prepared for. Remember, we had thousands of beds we made available. 149 was the height. We had 21 yesterday, right, across British Columbia. 18 of them in the Fraser Health Authority, 3 in the Vancouver Coastal Health Authority, and none in the other health authorities. So I look at hospitalization and critical care. And those are key factors. We also, though, have to keep in mind vulnerability. I'll give you an example. It's not near Kelowna, but in a community like Parksville or Qualicum Beach, which many of your members will be familiar with, but it shares a lot of qualities of the Okanagan as well. Many seniors retire to these communities. And in the interior, in the north, on Vancouver Island, there has not been high levels of COVID-19 from the beginning, right? In general, except in that period we saw the spike in Kelowna. But we do have a higher level of vulnerability. There are more of our elders in many communities and more people with chronic disease. So the potential and significant damage of an outbreak in a small community, be it right now, recently in July in Haida Gwaii or Fort St. John or others, is very high. And people in some communities are very vulnerable to COVID-19. So if an outbreak occurred in such a community, it would cause problems. People often ask, why don't you have regional approaches? Well, COVID-19 can affect all of us, right? And should an outbreak occur, as it did in Kelowna, it can affect all of us very dramatically. Later today at 4 o'clock on the BC CDC website, we're going to give more granular information about where we've had COVID-19 cases in BC. So you'll be able to see that there's been 21 cases in Vernon, for example, and so on, and how many in other smaller health. We've released it by a broader health area up to now, but we're going to release more granular information so people can see where COVID-19 has been prevalent in the province and where it isn't. And what we're going to continue to do is is, as we did, we provided our modeling before everyone else, is to provide people what we see every day in terms of COVID-19. But I think what we have to understand is, fundamentally, we're all in this together. There's no magic bullet. We can't all wear masks and then go back to the way things were before. It requires all of the actions. It requires physical distancing and washing our hands and wearing a mask. It requires enormous action in long-term care and in acute care. It requires incredible dedication by our health professionals and a determination as we open it up by grocery workers and by serving staff and by restaurant owners and by liquor store staff. And yes, by teaching assistants and teachers and others in their work to ensure that all of us are safe every day. And so we have to, I think, continue to have an atmosphere where we respect one another, where we don't blame people, where we respect and support one another. And when someone asks us to do something, even though we're going to their restaurant, and even though the customer is always right, if a serving person, and even if they're a lot younger than you, if a serving person asks you to do something, please do it. If we continue to act like British Columbians have acted, like people in Kelowna showed the way on, if we continue to act in a manner of respect and generosity, then we're going to be all right.
Well, thanks, Minister. And I appreciate we've run a little longer. I did want to note a couple of really good comments that I think fit well. It's not about the economy or the health. The health helps the economy. We're together on this. And a lot of this is population risk versus individual risk. And once you understand that, and I think you've explained that well, it gives a different perspective. I teased Nikki and she came in. I'm going to bring her back in. Nikki is our past president to provide a brief thank you to the minister. Thanks, Nikki, for jumping back in.
My pleasure to acknowledge and thank our guest speaker today. Minister, your insights and perspective as our province's Minister of Health are extremely insightful and helpful as we all try and navigate the short and long-term impacts of COVID-19. On behalf of the board and the staff at the Kelowna Chamber of Commerce and for all of those who have joined us online today, thank you very much for taking your time out of your busy schedule to speak with us. Some time ago, we shifted from providing a speaker's gift, and instead we will be making a small donation to a local charity on your behalf. This month's benefactor is the Okanagan Boys and Girls Club. Thank you very much.
Hey, thank you very much. And hey, I saw on the top of my screen at some point a message from my friend Ron Cannon that I hadn't answered a question correctly, or I hadn't answered it sufficiently. Tell Ron to send me an email. I'll try and do better.
You'll get several then, yes.
I love it. I love it.
Yeah. Minister, thanks very much. Jeff, also for the time. It's been great to have you on, and we look forward to having you back again, Minister. Thanks very much.
Thank you. Take care.
And thanks very much to all those that have joined us as well on this session. Our media panel is in September, so we look forward to joining you there. In the meantime, enjoy the sunshine in the Okanagan if that's where you are, and have a great weekend as we approach the end of August.